Hello, I'm Hannah Hackman. I'm an occupational therapy doctoral student at the University of Indianapolis. I'm partnering with Schneck Medical Center to create a community resource for caregivers of those with Alzheimer's disease. I have been a Jackson County native for my whole life, and I am eager to provide this community resource. Let's begin with some basic facts about Alzheimer's. According to the Alzheimer's Association, Alzheimer's is the most common cause of dementia, a general term for memory loss and other cognitive abilities serious enough to interfere with daily life. This disease is not a normal part of aging. It is a progressive disease that worsens over time. There is no current cure for Alzheimer's, but there are treatments available for symptom management as researchers do their best to advance medicine in this area. Changes to the brain begin long before any symptoms appear. Abnormal proteins build up, decreasing cellular efficiency and causing irreversible changes in the brain. Symptoms of Alzheimer's disease worsen over time, although the rate of disease progression varies. Alzheimer's disease progresses in stages. The first stage is known as early stage Alzheimer's, or mild stage. During this stage, your loved one may function independently, but may feel as though they are having lapses in memory. Common difficulties include coming up with the right word or name, remembering names when introduced to new people, forgetting material that was just read, losing or misplacing a valuable object, and increased difficulty with planning and organizing. During early stage Alzheimer's, your role as a caregiver will include planning and support. Early in this stage, symptoms may be hard to detect, but if you take notice of any, contact a doctor immediately in order for your loved one to receive the proper care. Your role during this stage may be to provide support and companionship, or a plan for the future to ensure your loved one's wishes for end-of-life care. Financial planning, estate management are in place. Your loved one may need reminders for keeping appointments, help managing medications or money, remembering words or names, or help with planning or organizing. Encourage your loved one to remain active in doing their favorite things. Find meaning in their life and keeping an open line of communication. There are many resources in our community that can be beneficial during this time. The Alzheimer's Association website has a lot of information as you learn about the disease. We have a local neurologist, Dr. Matt Meyer, who can help with diagnosis and treatment. And there are many options for estate planning that may be very helpful during this stage. The second stage of Alzheimer's disease is known as middle stage Alzheimer's, or the moderate stage. This stage is usually the longest stage of Alzheimer's and can last for several years, requiring a progressively greater level of care. During this stage, symptoms become more pronounced, although they may vary from person to person. Continued damage to nerve cells in the brain make it difficult for the person to express thoughts and perform routine tasks without assistance. Symptoms can include being forgetful of events or personal history, feeling withdrawn or moody, especially in socially or mentally challenging situations, being unable to recall information about themselves, for example, address or the high school they attended, experiencing confusion about where they are, the date or the time, requiring help choosing the proper clothing for the season or the occasion, difficulty with bowel and bladder control, changes in sleep patterns. They may sleep during the day and become restless at night. Increased tendency to wander or become lost. They may demonstrate personality and behavioral changes, including suspiciousness and delusions, or compulsive, repetitive behavior, such as hand-wringing. Your role as a caregiver during this stage will require a lot of patience and flexibility as your loved one's independence begins to decline. Daily routines and tasks may need to be modified according to your loved one's ability to complete them. Eating, dressing, bathing, and grooming will continue to become difficult. Allow plenty of time to complete these activities and do not rush them. Allow your loved one to be as independent as possible while providing clear instructions. Lay out appropriate clothes. Demonstrate how to comb hair. Changes in behavior and communication will occur, so it is important to use a calm voice and provide reassurance when necessary. Use simple written reminders via a whiteboard or calendar in order to help them orient to the events of the day or the time. Label cabinets or closets with the contents of what is inside. Provide your loved one with activities that they haven't always enjoyed doing in the past, which will help reduce wondering and frustration, like listening to music, going on a walk, baking, etc. Your loved one will need to stop driving during this stage. Involve them in this conversation and give examples as to why this is necessary. Home safety will become an issue as the chance for wandering increases. There are some strategies to try that may help. Make sure deadbolts are out of your loved one's reach. Have well-lit hallways. Remove rugs and keep floors clutter-free. Ensure medications are locked away until their necessary use. Keep all chemicals, cleaning supplies, tools, and equipment out of reach. Watch the temperature of water and food as your loved one's sensation may begin to deteriorate. Support their needs and promote activity while ensuring safety. Contact the doctor if you notice changes to rule out any other problems with medications or new diagnoses. Some local resources that may be helpful during the moderate stage of Alzheimer's include those listed earlier and in-home care services and medication delivery services. The third stage of Alzheimer's disease is known as late-stage Alzheimer's, or the severe stage. Symptoms in this stage may become more severe. Your loved one may lose the ability to respond to their environment, to carry on a conversation, and eventually to control movement. They may still say a few words or phrases, but they will have trouble telling you if they are having any pain. Also, drastic changes in their personality may take place, given continued decline of cognition. The Alzheimer's Association notes that, quote, "In this stage, your loved one may require constant assistance with daily tasks, including personal care. They may lose awareness of surroundings and recent experiences, encounter changes in physical abilities, such as walking, sitting, and eventually swallowing, have difficulty with communication, and become vulnerable to infections, especially pneumonia," end quote. Your loved one may not be able to initiate engagement as much during the late stage, but they can still benefit from appropriate interaction, such as reassurance through gentle touch or listening to calm music. Your role during this stage is one of support and comfort, as you will most likely require help from outside services, such as hospice care and home health, or a long-term care facility, like those listed on screen. These services focus on providing dignity and comfort for both the family and your loved one during end-of-life care. To qualify for hospice benefits under Medicare, the physician must diagnose the person with Alzheimer's disease as having less than 6 months to live. At this stage, the caregiver role may be as simple as providing care through touch, sight, sound, smell, and taste. This can be accomplished by looking at old photos, fixing a favorite meal, rubbing a favorite lotion or perfume into their skin, brushing their hair, or sitting outside on a nice day. As a caregiver, it is important to address daily tasks such as eating and toileting, skin integrity, infections, and pain or illness during the final stage of your loved one's life. The Alzheimer's Association has recommendations for daily tasks. As your loved one becomes less active, they will require less food, or they may forget to eat or lose their appetite. The doctor may recommend supplements between meals or adding sugar to various foods to encourage eating. Allow plenty of time for eating. Make sure the person is comfortable and sit them upright for at least 30 minutes to aid with digestion. Adopt foods such as yogurt or applesauce as swallowing ability declines. Encourage self-feeding with cues, putting food on a spoon, wrapping their hand around the spoon, guiding it to their mouth. And serve finger foods if they have difficulty with utensil use. You may need to remind the person to chew or swallow before continuing with the next bite. Encourage fluids in any way possible and check the temperature of the fluids before serving them. Monitor weight and notify the doctor if drastic changes occur. Make a routine and document when your loved one eats or drinks and how often they use the bathroom. A bedside commode may be recommended to improve efficiency with transferring during this stage. Limit liquids at least 2 hours before bedtime. Utilize disposable briefs and bed pads at night. Monitor bowel movements. If it has been longer than 3 days, he or she may be constipated. It may help to add natural laxatives and fiber-rich foods to the diet. Consult a doctor if the constipation continues. Your loved one may become bed or chair bound. Therefore, it is important to change the person's position every 2 hours to relieve pressure and improve circulation. Make sure they are comfortable. You can use pillows to support arms and legs. Learn how to lift and turn them by consulting an occupational therapist, physical therapist, or nurse. Do not pull on their arms or shoulders. Keep the skin clean and dry. Be gentle during cleaning and watch for skin breakdown. Protect bony areas with pillows or pads, such as on the hips, elbows, heels, etc. Prevent freezing of the joints or limb contractures that can occur when your loved one is confined to a chair or bed. It is helpful to do range of motion exercises in order to prevent this, especially after bathing when the skin and muscles are warm. Consult with a doctor before starting these exercises. Keep the teeth and mouth clean. Use a soft toothbrush or moistened gauze pad to clean the gums and tongue. Treat cuts and scrapes immediately. Protect against the flu, pneumonia, and COVID-19. Get vaccinated to reduce risk. Look for physical signs such as flushed skin tone, dry or pale gums, mouth sores, vomiting, feverish skin, and swelling. Look for nonverbal signs such as gestures, spoken sounds, and facial expressions. Be alert to any changes in behavior such as anxiety, agitation, trembling, shouting, and sleeping. Notify your doctor if you notice these signs. Thank you for watching. We have a full list of the resources I've mentioned throughout the video on our website. The resources will also be listed again on screen in a moment. Be sure to tune in to our next video, where we will give you more hands-on direction for caring for your loved one with Alzheimer's.